my grandpa's 85 and he's hilarious and he comes up with jokes for me to tell my patients to help them through medical problems. I'm Dr. Gloudeman. I've worked as a doctor for nearly a decade, and particularly in palliative care, old age psychiatry, and geriatric medicine. So I've seen patients and their families with complex medical problems. In this video, I'm going to tell you a little bit about my grandpa and like what it was like growing up with him, because he's super funny. I'll tell you the first phrase that I used that helped me with one of my patients that he used to say all the time, and then the two jokes that I love at the end that are super funny. And so, first and foremost, if you are a grandparent, I just want to say thank you. You have no idea how much joy you bring to your grandchildren. Like, I was lucky enough to have 3 of my 4 grandparents, and I have so many fond memories with them. So if you're a grandparent, please know how much you're going to be treasured. If you never had that opportunity, unfortunately, some people don't. Find someone in their 70s and their 80s and their 90s. They have so much value, and they provide so much, not only just entertainment, but wisdom, and it can be quirky and interesting. So yeah, find that person in your life, and if you don't have someone like that. So a little bit about my grandpa. So he worked for the county. Like, I'm the only doctor in my family, so he did like snow plowing and like parks and recreation kind of work for the city. And when I was a kid, he was really funny with me, and he knew I was kind of clever and did good in school. So he'd say stuff like, "Hey, you're one smart feller." And my grandma would be mad and be like, "Don't say that to the kids, Bob." And then he'd say it anyways, he didn't care. And I remember when we retired, we were little at the time too, like he would pretend he didn't know how to say the word work. So we'd be like, "Grandpa, you going to work today?" Kind of egging him on. He'd be like, "Whoa, whoa, whoa, I don't know that word. What are you trying to say? Whoa, whoa, whoa." Super funny. Even when I went to medical school, he was like, "What are you going to spend all that time and money for to learn the phrase, 'Take 2 of these and call me in the morning'?" So that's my grandpa. Super, super funny. And he used this one phrase that I really liked to kind of help me grapple with decisions a little bit, which was, "Take a chance, Columbus did." So one of my patients was really struggling with like deciding whether to go to a scan for an MRI, or you're like maybe a little bit claustrophobic. It can be kind of stressful. He was in the similar edge category to my grandpa, and I just said, like, if you ask my grandpa what to do, he's about your age, just say like, "Take a chance, Columbus did." The guy laughed. He's like, "Ah, yeah, okay, right." He went ahead with the scan. I mean, it turned out fine. I told my grandpa the story, and he kind of got a kick out of the fact that one of his funny phrases helped one of my patients. So he started giving me more funny phrases, and one of them was like, "It's not for the faint of heart getting older." And I share that with my patients because, when you have like multiple illnesses compounding, like building up over years, it's difficult to like change everything to be perfect. But there's things you can do around the edges to try and help, and you also can like think, years in advance as well, what can benefit my patients in that age category. And the other one is, he said, like, "I'm getting older every day." So I sometimes say that to my patients, that my grandpa tells me these things. And then he came up with a couple of jokes that I love. And this is the 2 jokes that are the best that I think. If you're struggling with urinary symptoms, this is the joke my 85-year-old grandpa shared with me that might help you. So that might mean you're like struggling with your prostate and going to the toilet quite a bit, or you're like struggling to get to the toilet. That might be like urge or stress incontinence, where you lose control a little bit and have accidents. It can be quite embarrassing. So my grandpa says, when you're older, they say you revert back to your childhood. But peeing your pants and drooling on your shirt isn't as fun as it used to be. So super funny. My patients get a kick out of it, and we try and help them with these problems they have. A lot of my patients are stressed out about side effects of medication, and so much so that they might not even take a medication that could help them. So this is a joke my 85-year-old grandpa shared with me, and he was really excited about this one. And I used to say, they do these big clinical trials. So they first test it on healthy people, usually healthy young people that don't have any problems. Then they test it on the people that need the drug, and then they roll it out if it works. And then all that feedback that they get goes into the list of side effects potentially. And so a lot of patients will read that list before they even take a drug, and they get worried. So this is the joke my grandpa said to me that might help you. So one of his drugs can cause anal redness. He said, "I'm 85 now. I can't really look back there. Do you think I should go to the grocery store, gather some people around me, and be like, 'Hey, one of my drugs causes anal redness. Do you mind kind of having a look for me to see if it's causing the problem?'" It's ridiculous, obviously, and like, I'm not going to do it. But Point is like, it helps my patients understand that like your genetically unique environmental social factors are unique to you. If there's side effects, know about them so that if you're running into trouble, you can get in touch. So I hope this video helps you. If you like it, don't do this for me, do it for my grandpa, because I'll be able to share it with him. Just make a little comment down below. I'm sure he'd get a kick out of anybody saying anything about the jokes he has.